So let me say something about our keynote speaker. First, Brian Earp is a philosopher, a cognitive scientist, and a bioethicist, based primarily at the University of Oxford. He's a senior research fellow there in moral psychology, particularly within the Oxford Uehiro Center for Practical Ethics. He's also co-director of the Oxford Experimental Bioethics Lab, and he's an honorary faculty in the Oxford Department of Experimental Philosophy. So Brian is a very interdisciplinary fellow. He's finally also an associate director of the Yale Hastings Program in Ethics and Health Policy at Yale University in the US. And with Julian Savulescu, he is co-author of this beautifully edited book, written and published book, Love is the Drug. It's called The Chemical Future of Our Relationships. It's published just a few years ago. Now, our keynote speaker will talk about the use, as you know, the use of certain psychedelic substances to bring about moral improvement in human beings. So that means to improve human beings qua moral agents. Without further ado, ladies and gentlemen, please join me in welcoming our speaker, Brian Earp.
Okay, it's working. Hello, it's nice to see you all. Thanks for turning out. I'll be speaking about psychedelic moral enhancement, which I imagine is a phrase that you maybe haven't heard before today. So I want to step back and talk about a more familiar debate just to get us oriented. And that's a debate around cognitive enhancement, which is something that's been talked about in bioethics for a long time. It's discussed in public forums and in newspapers and so forth. It's a more familiar issue. So I happen to be on a cognitive enhancer right now. I came in from London this morning. I had about a gallon of coffee just to get my brain functioning. And the way this debate typically plays out is that some substances are seen as okay for cognitive improvement if you've been diagnosed with a medical problem. So the thought is if you want to take a drug, a medicine like methylphenidate or Ritalin, or however it may be branded here, the thought is you have to have a medical problem. Otherwise, you shouldn't be using these substances to turn up your mental faculties. And then there's always these gray area cases like coffee, where, okay, fair enough, you don't have to have an anti-coffee disorder or something in order to be justified in drinking this, but it's a more familiar drug, so we're used to it. Now, here's one problem that cognitive enhancement raises for people. If you take a drug that's not familiar like coffee, if you take a stronger drug, and it wasn't prescribed to you by your doctor, and you're using it to get some kind of advantage in school or work over your classmates, then it starts to raise issues of unfairness, where people think maybe you're cheating in a certain kind of a way. You know, there are some zero-sum games where only one person's going to get the top grade and get the promotion or whatever it may be. So this raised questions of, is there fairness? Is there something just immoral or wrong about doing cognitive enhancement, at least in certain kinds of cases? So this debate's been going on for 30, 40 years in the bioethics literature, and then in 2008, something very interesting happened. My colleague at Oxford, Tom Douglas, proposed in a philosophy journal that maybe we should be thinking about something like moral enhancement. What if we could take a drug that, instead of just making us pay attention better or focus more easily, made us somehow better as moral beings? This would seem to sidestep the concerns about cognitive enhancement being unfair or unethical, because it almost seems like, by definition, if I take a drug that makes me more moral, and therefore more respectful of my relationships toward others, and more able to honor my duties and so forth, how could anyone object to such a thing? Now, it turns out there's lots of objections to this idea, and I'll get into some of them. But this was basically a theoretical move. It was a way of dealing with some of these concerns that people brought up about cognitive enhancement. And then there was this hypothetical example of moral enhancement that Tom suggested we should consider. Tom also focused on individual moral enhancement. He said, listen, I'm not suggesting we should put morality drugs in the water or something like that. I'm just saying individuals, if they wish, if there were some sort of way of intervening in their brain to improve their moral character, their moral behavior in some way, they should be permitted to do so. So he was making a pretty modest claim in the original part of this debate. But then an interesting shift happened. So Professor Julian Savulescu was mentioned earlier. With Ingemar Persson, he suggested that maybe we should sort of put these drugs in the water. He said there's an urgent need to morally enhance all of humanity. And the argument here is that we humans are intrinsically flawed compared to the world we've created for ourselves with technology and advanced medical tools and so forth. The ability to fly across continents, the ability to affect the long-term future. The idea is that we evolved in an environment for however many thousands of years with, at most, maybe 150 people that we could impact in any real way. And so our moral psychology, our sense of right and wrong, our ability to even picture certain possible outcomes in a vivid way are intrinsically constrained by this evolutionary history. But now, of course, we have the possibility of nuclear war, or the problem of climate change, which requires coordination across people from different nations. And it's just not intuitive to each individual to do the kinds of things they need to do to potentially prevent the destruction of the planet. And so by stacking the deck a little bit, Professor Savulescu and Ingemar Persson argued that these are desperate situations. And so at the very least, we shouldn't rule out the possibility of researching biotechnological ways of somehow souping up the engine of human moral cognition so that we can face the challenges that we face based on the way that we've culturally evolved and technologically evolved and so forth. So that still sounds maybe a little bit hypothetical. You might be imagining, is this some sort of morality pill? What would this actually be? And you know, philosophers like to stipulate things. They like to say, suppose there were a pill that had these kinds of effects. And that maybe works as a thought experiment. But these proposals were offered sincerely. The thought was, this isn't just a thought experiment. We need to actually do some research and find out how we can use neuroscience and biotechnology to potentially influence our moral thinking. So what are some specific proposals? Well, there's different ways of stimulating the brain with magnetic or electric currents, and some of this research suggests that you can use these brain stimulation devices to reduce impulsive tendencies. For example, if you suffer from psychopathy or you are a psychopath, depending on how you want to say it, you have a tendency to act impulsively in ways that may harm others. So if you could intervene in the brain and directly reduce those impulsive tendencies, well, maybe that would count as a moral enhancement. Some of these devices, there's some evidence suggesting that maybe they can improve self-control. But now I want to introduce this idea that that might be a double-edged sword. Having self-control is a good thing if you're a good person. You want to be able to summon your energies and pursue your goals in the most controlled and efficient way. But if you're an evil person and you have more self-control, it's not clear that that's something we should desire. If you have bad motives or you're inclined to mistreat other people, you might just be able to execute your plans even more effectively and do greater harm. So we have to think about, for each of these possible ways of changing our cognition, is that really a good thing across all circumstances? Or is it something that only in very specific circumstances or in specific kinds of ways could plausibly count as a moral enhancer? There have also been some suggestions to manipulate hormone levels, including serotonin and testosterone. Now, testosterone manipulation has been done for quite some time in some jurisdictions as a way of chemically castrating repeat sex offenders, sometimes as a condition of parole. Basically, introducing testosterone-blocking drugs to reduce libido to the point where the sex offender loses their interest in sexual activity and therefore should be less inclined to harm others in a sexual way. That's the idea. So maybe that's a moral enhancer. If you have somebody who's regularly misusing their libido, and harming other people in a way that we can all agree is impermissible, then perhaps intervening in this blunt, messy way and just destroying that capacity is something that could count as a moral enhancer for some people. Manipulating serotonin seems to be able to reduce aggression in some people, and it disinclines people from a willingness to harm others. So that sounds good. I mean, harming others is a key central example of immoral behavior, unless it's justified by very particular conditions. But we, again, have to think about the context. You know, imagine that you're one of those passengers on the hijacked airplanes, and you have to engage aggressively with somebody who might be frightening. And if you lacked a willingness to harm them, you might have negative side effects for everybody. The plane goes down, you have worse consequences. Imagine that you're a parent whose child is being threatened by someone who's going to harm the child. It might be that you need to be willing to defend the child and to be aggressive in doing so. So if you took some kind of pill or had a brain stimulation device or altered your hormones in such a way that your overall aggression or your overall willingness to harm was decreased, what I'm proposing is that that might not be an all things considered moral enhancer, because depending on the context, a willingness to harm other people or hurt other people can be justified, and it can be morally required. Another example that's been raised is methylphenidate, Ritalin. So this is what I was contrasting with caffeine earlier on. They actually work somewhat similarly on the brain. Caffeine's a much more familiar drug. And this has been proposed that this could be prescribed for children who have what's called conduct disorder, which is a sort of socially constructed idea. What counts as conduct disorder depends on what are the norms for appropriate behavior. And the critique of these sorts of suggestions is it's not clear that you're morally enhancing the child if you get them to behave in a more socially prescribed way, because they're not necessarily doing it for reasons. They're not understanding what it is to be a moral person. You're just controlling their behavior in a kind of a way. So is controlling someone's behavior the same thing as morally enhancing them as an agent, as a being, as a human relationship partner? Here's another interesting proposal. Propranolol is a drug that's a beta blocker, so sometimes performers will use this drug to calm their nerves down. And there's a couple of studies that have shown that if you take a test which is meant to measure implicit racial bias, and you do it under the influence of this drug, your racial bias score drops. So this got a lot of excitement and attention that maybe there was a drug that could reduce racial bias in a way. Now, some people said, that just sounds like the medicalization of racism, turning it into an individual level problem. Here, you've got some racism, here, take this drug. You've got some racism, take this drug. Instead of thinking of it as, a structural problem or something to have to do with the way institutions are designed and so forth. So these authors had a somewhat tongue-in-cheek title of a paper they published critiquing this whole notion, where they said, oh, you're racist? Well, I've got a cure for that, and it's some sort of medical drug. And they were proposing that that's not a good idea. That's not how we should really be thinking about tackling problems with racial bias or racism. And the last example here is oxytocin. Some of you may have heard of oxytocin. It's called the love drug in some popular media, but oxytocin does a lot of different things. It's a neurohormone. It is part of the birthing process. It's released during sex and orgasm, and it's part of a bonding chemical. But it also seems to increase trust and empathy in some cases, depending on how you measure that in the laboratory environment. And so again, boosting trust and empathy, being able to empathize with other people seems like a good thing. But imagine if you're in a situation where empathizing is not all things considered what you should be doing. Imagine you're a judge and you have a criminal defendant. And the just thing to do, the right thing to do, is to give them a certain kind of sentence, something that they deserve. But if you empathize with their situation overly much, it might be that you do something unjust. You give them a sentence that's too lenient, because you're trying really hard to see things from their perspective instead of, for example, from the perspective of a victim. Empathy is also a very parochial capacity. We tend to empathize for those who look like us, who we have close relationships with, and so forth. We don't tend to empathize with people in far-off places or who seem different. And so boosting empathy, depending on how you try to do it, could just mean boosting your tendency to empathize with those close to you, and even increase your tendency, in some studies, to treat others as more distant from you. And just a scientific caveat, a lot of these early oxytocin studies don't seem to replicate. And this is a deeper problem with science that maybe we can talk about during the Q&A. But some of these laboratory studies that get a lot of attention in the newspapers are very flashy, and they're kind of exciting to see what the scientists have discovered. But then other scientists don't necessarily repeat the exact same experiment because they want to get their own fame and glory for doing something different. And so there's a lot of one-off studies out there in the literature that everybody kind of just hopes would replicate. And until some scientists got down and tried to do it, and then found that a lot of them didn't replicate, it was just a matter of sort of mutual faith in the scientific process. So this is now a big problem in science, where the incentive structures for scientists is not to do exact copies of other people's work, because I have to get tenure in a certain number of years. And so people aren't systematically checking each other's work, and this affects not just the oxytocin research, but a lot of research. So I'm just going to summarize some of the problems with these specific proposals that have been offered. One is that they all seem to focus on a specific kind of dial adjustment, where the hope is that you could get in there in the brain with a drug or a brain-stimulating device, and you could tweak the settings of some capacity, like aggressiveness or empathy, until you get it to somehow what you take to be the right levels. And there's a number of problems with this. One of them is just a physical problem that has to do with how the brain works. The brain evolved over millennia and eons in a process of natural selection that tinkers with the existing model. We don't have this nice blueprint where we can just reverse engineer the brain and know how everything works. So our interventions tend to be messy. If you intervene into the brain, you might enhance one capacity, but then decrease another capacity at the same time, even though you didn't intend to. Or you might just have side effects such that it wouldn't be worth intervening in that way. Furthermore, this dial adjustment thing falls down on the context issue. So again, if you reduce somebody's aggressiveness or their willingness to harm other people, seems like that could be a good thing, but if you're a parent who's aggressively defending your child, that might not be a good thing. Now, I alluded to the fact that there might be some people who are so morally disordered that it could be justified to do one of these blunt measures, like reducing the libido in a repeat sex offender in some kind of a way. There's a debate about that, but maybe it's a little bit more plausible. Again, though, is that moral enhancement, or are you just controlling somebody's behavior? Did they become a better person, or are they just less likely to cause harm? So I just alluded to the fact that there's side effects, which can be physical side effects when you intervene in the brain, but there's also side effects on different capacities. You might be messing up something that you actually need to be a moral person, and so you might get a trade-off. That happens a lot when you intervene with neurotechnology into the brain. My colleague, Tom Douglas, who kicked off this whole line of research, has said, yeah, that's true, but that's true of every drug we use in psychiatry. There are no magic bullets in psychiatry where you give somebody an antidepressant drug and all it does is solve the depression. You also get effects on sex drive, you get nausea, you get other kinds of problems. So he says, even so, it might still be, all things considered, desirable to take the drug. Now again, we could get into a whole bunch of debates about psychiatry and which drugs are effective and which ones aren't, but that was kind of the point that Tom wanted to make. And I mentioned this empirical limitation that a lot of these studies that have generated this philosophical discussion and this buzz and excitement may not even replicate. They may not represent true findings. And furthermore, even if they did represent true findings, they're done in these highly circumscribed laboratory environments where you have an economic game or something like that, but it's not clear that that would generalize to the real world. Taking propranolol is probably not going to actually reduce your racism in society, even if it changes your measure on this artificial task that you can do in a laboratory. So a lot of people started to feel like maybe this is a dead end. It seemed exciting, We were going to try to re-engineer human beings to be more moral so that we could solve the problem of climate change and we could ward off all sorts of existential threats. And then these kinds of critiques caused people to worry that maybe it wasn't possible to do this in some sort of tinkering with the brain kind of a way. So what some philosophers did then is they stepped back. They said, okay, let's zoom out. Let's not talk so much about neuroscience and brain chemistry. Let's think of other ways that we can influence people's moral dispositions, actually get them to be better people. So one philosopher has argued for what he calls indirect moral enhancements, which is interventions that might be biomedical, or they might just be educational, to help people reason better and to strengthen their willpower. And the thought is that moral reasons are a type of reason. We can see that there's a reason not to arbitrarily harm someone. And if we can't see that, it seems like just helping us grasp that kind of a reason might very well make us a more moral person, if we tend to be responsive to moral reasons. And similarly, strengthening willpower. Again, there's a risk here. Some people, if you strengthen their willpower, if they're an evil person, may just do more harm. And you can't necessarily control which reasons they find compelling. Maybe they find a hateful ideology compelling, and then they use their reasoning within that ideology to bring about more harm. It seems like, how are you going to control for that? Another author, Harris Wiseman, has argued for soft moral enhancement, which encompasses everything from social control to paternalism, lawmaking, medicine, and mental health, all of whose institutions, he argues, involve intervening in behavior to prevent and punish activities that are not explicitly immoral, but that have morally related dimensions. So maybe that's the solution. But of course, that sounds just a little bit like what we already do. That's the standard status quo, is to try to shape people's moral behavior through education and law and policy and so forth. So Robert Sparrow says, that's just changing the topic. We're not talking about moral bioenhancement anymore. You're just talking about traditional moral enhancement, which people have been writing about for 1,000 years, but it's not what we were talking about when we had this exciting new literature that was developing. So he says it like this: debate about moral bioenhancement is shaped, at least in part, by hopes and fears about the impacts of scientific research into the human brain, especially its anatomy and neurochemistry, into genetics, into technologies that might leverage the insights offered by these kinds of research to make people more moral in some sense. Such interventions would alter human biology and not just human behavior. That is to say, the bio is essential to the philosophical and cultural buzz around moral bioenhancement. If every revision of social mores or attempt at institutional design directed toward getting people to behave in particular desirable ways, if that counts as moral bioenhancement, then the category dissolves into meaninglessness. And then John Harris, a very prominent bioethicist, added to this point by saying, it doesn't seem that we'll be susceptible to new forms of high-tech manipulation, either genetic or chemical or surgical or neurological. The only reliable methods of moral enhancement, either now or for the foreseeable future, are those that have been in human and animal use for millennia, namely socialization, education, parental supervision, or those high-tech methods that are general in their application, that don't target moral capacities in particular. So he says, by that is meant those forms of cognitive enhancement that operate across a wide range of cognitive abilities and do not target specifically ethical capacities. But as you remember, that's where we started this whole conversation, was with cognitive enhancement. That's the debate we've been having for 40 years within bioethics. So we've kind of just come full circle. It's not clear we've learned anything. That all this excitement and all these papers being published, I mean, there's hundreds and hundreds of papers on this idea of moral bioenhancement. And if you look at the literature over the last 10 years, or since Tom first came out with this paper, so more than 10 years ago, it seems like it's sort of stalled. It hasn't gone anywhere. So I wrote a paper in 2018 reflecting on all of these trends. And I thought, okay, let's go with Sparrow's suggestion. Let's ask ourselves, what do we really want in a technology for it to count as a moral bioenhancer? Well, it has to keep the bio, like Sparrow said, so I'm going to rule out any purely social or environmental kinds of interventions. Those aren't going to count as moral bioenhancers. We also have to avoid that dial adjustment problem, the thing where we try to find some stable setting for empathy levels or aggression levels, because depending on the context, you might need to be able to change that feature. And then this final point, we want to keep Harris's insight that we want a general capacity to flexibly respond to different kinds of situations. We don't want to just set a narrow ethical dial at a certain level. We want to be able to adapt to our situation and employ our moral emotions in the way that's required at the time and towards certain ends. And so he says, well, the only way to do that, have a general enhancement, is through cognitive enhancement. But what I'm proposing is, for it to count as moral bioenhancement, there does need to be something distinctively moral about it. So the question is, do any known substances actually meet all of those conditions? And I think there are. So this is where I'm going to get to the part of my talk that I alluded to at the very beginning in the title slide, and I'll be talking about psychedelic moral enhancement. So this is probably a good point to take a sip of water. So the idea of psychedelics as moral enhancers, it depends on the language you use, but on one conceptualization, this is an extremely old idea. This is not a radical new idea that I came up with myself. Psychedelic drugs and other psychotropic substances that alter human consciousness have been in use for millennia in some societies. It's not just a recent thing with hippie culture either. These are spiritual technologies that have been used by indigenous cultures, including ayahuasca in the Amazon basin for, again, potentially thousands of years. And peyote, a cactus that has psychotropic properties when prepared a certain way, is used by the Native American church in the United States and so forth. So the way that these drugs are characterized is not really as cognitive enhancers, although they do change our cognition in certain kinds of ways. But many people who use them, especially in a community context, will talk about them as somehow healing the bonds of the community, getting people, generally speaking, to be more resilient, more forgiving, more understanding of others' perspectives, but not in a way where they just have one new setting that they're stuck at, but in a way where they're flexible and responsive to the context. Sometimes it will be spoken about as kind of spiritual enhancement. Now, if you're a secular person and you're not sure what spiritual means, my inclination is to think that when people talk about spiritual enhancement, that's pretty close to what the philosophers were talking about when they were mentioning moral enhancement. And I'll just give you some specific examples so you can see the sort of thing that I mean. Ron Cole Turner is a theologian, and he argues the most readily bioenhanceable human trait may in fact be our capacity for spiritual experience. Compared to body enhancement through cosmetic surgery, spiritual enhancement is inexpensive and relatively physically painless. Compared to cognitive enhancement, spiritual enhancement is highly effective and enduring. You take a cognitive enhancing drug, it wears off as soon as the effects of the drug wear off. But if you think of the use of these psychedelic substances in a community setting, sometimes people will talk about being changed permanently. That after they had that one very intense experience, they felt they gained new insights into how human beings work and what love is all about, and so forth. And compared to lifespan extension, compelling evidence shows that spiritual enhancement actually works in a highly positive and predictable way. And I'll come back to what the compelling evidence is, because it's easy to be misled. So this is how I summarized the proposal in this 2018 paper. I said, altered states of consciousness brought about in part or in whole by the ingestion of certain biochemical substances, so keeping the bio, have long been considered to yield, whether on their own or in conjunction with other teachings or practices, important insights into the nature of reality and human existence, often with transformative implications for how we should live from a moral perspective. Now, depending on what you know about or think about psychedelic drugs, especially if you associate it with hippie culture or something like that, you might think of the drugs as recreational drugs, drugs that are there to have a fun time, but that don't have any real significance at a deeper level. And some people maintain that view. But if you talk to people who have had experiences with these drugs, they aren't just saying, yeah, I hallucinated, it was really interesting, the walls were moving. They may say that. But they'll often also say, I felt that I learned something. And then when the drug wears off and they integrate those lessons into their normal waking consciousness, they continue to reflectively endorse the insights that they felt that they gained under the influence of the drug. And the point that I want to make is that this will only work if the drug is enhancing a sort of structured, traditional practice of moral learning. If you just take a drug in your basement with your friends and turn on some great music, you're not going to be morally enhanced. But if you're thinking about what it means to be a good person, if you're studying certain practices that have long traditions, if you're reading moral philosophy, then maybe the drug could enhance that process because you've got some structure built in. So Robert Sparrow says, it's hard to see how any drug could alter our beliefs in such a way as to track the reasons we have to act morally. Someone who reads Tolstoy arguably learns reasons to be less judgmental, and in doing so develops greater understanding. Whereas someone who just takes a pill has merely caused their sentiments to alter. Now, I think this might be a bit prejudiced. This is the sort of old Aristotelian idea of separating the rational part of us from the emotional animal part of us. And actually, our emotions play an enormous role in how we process moral information. Conscious, explicitly accessible, endorsable reasons is a part of how we should navigate the moral world. But sometimes there's this dismissing about merely causing one's sentiments to alter. Sometimes if we alter our sentiments in a certain kind of a way, that can incline us to see different types of reasons that apply to us in that situation. In any event, our response was to say, we're not saying you should either take a drug or read Tolstoy. Keep reading Tolstoy. But it might be that process could be enhanced by the conjunctive use of a drug plus traditional moral learning. Now again, this is not a new idea to me. Aldous Huxley, in The Doors of Perception, wrote in 1954, the mescaline experience, a different psychedelic drug, is what Catholic theologians call a gratuitous grace. It's not necessary to achieve salvation, but potentially helpful and to be accepted thankfully if made available. To be shaken out of the ruts of ordinary perception, to be shown for a few timeless hours the inner and the outer world, not as they appear to an animal obsessed with survival or to a human being obsessed with words and notions, But as they are apprehended directly and unconditionally by mind at large, this is an experience of inestimable value. William James, famous psychologist and philosopher, very influential, wrote in The Varieties of Religious Experience about his experience with nitrous oxide, which is not a psychedelic, but it does have some hallucinatory properties. He says, these drug-induced altered states of consciousness may influence attitudes, but they don't furnish formulas. They don't determine that you end up believing a certain thing. They can open a region, but they fail to give a map telling you where to go. One of the most beautiful quotes anywhere, but by James in that book, is the following. One conclusion was forced upon my mind at that time that he inhaled nitrous oxide. My impression of its truth has ever since remained unshaken. It's that our normal waking consciousness, rational consciousness, as we call it, is but one special type of consciousness. Whilst all about it, parted from it by the filmiest of screens, there lie potential forms of consciousness entirely different. We may go through life without suspecting their existence, but apply the requisite stimulus, and at a touch, they are there in all their completeness. Definite types of mentality, which probably somewhere have their field of application and adaptation. And I'm suggesting, or I suggested in this paper, that one potential field of application might be intentional moral enhancement. Finally, a more recent author, Richards, who is part of the Johns Hopkins team that's been doing a bunch of scientific research on psychedelics as part of the so-called scientific renaissance, which I'll tell you about, argues it's clear that psilocybin is the active ingredient in so-called magic mushrooms. It can never be responsibly administered as a medication to be taken independent of preparation and careful attention to the powerful variables of one's mindset and physical setting. One cannot take psilocybin as a pill to cure one's alienation, neuroses, addiction, or fear of death, in the same way one takes aspirin to banish a headache. What psilocybin does, and this is like what Huxley says, is provide an opportunity to explore a range of non-ordinary states. It unlocks a door. How far one ventures through the doorway and what awaits one largely is dependent on non-drug variables. So that's the idea. If we take all those caveats in mind, that taking a drug in your basement with some great music is not going to morally enhance you, but taking a drug in conjunction with deliberate moral study might, what's the implication of that? Some people who are psychedelic enthusiasts might say, great, unleash the psychedelics. We've got a great reason. We'll have a utopia. We'll all be psychedelically enhanced moral beings, and we'll usher in a new age of love and peace, which sounds a lot like the hippie mottos of the 1950s, and it didn't necessarily usher in that type of age. So, not so fast. I mentioned that there's this psychedelic renaissance going on, based in Johns Hopkins and Harvard and Yale and New York University and Imperial College London. There's centers all over the world now doing very rigorous scientific research into the medical benefits of psychedelic-assisted psychotherapies for certain kinds of otherwise incurable conditions. So, as a consequence of this research, psychedelics are now being quickly ushered back into the mainstream. So, here I am talking about this, and I don't spend a lot of time in underground communities trying to, change things. This is now what, mainstream academics are having to grapple with. This is something we all have to grapple with. One way this has happened is through the process of medicalization. Medicine and science are generally respected institutions. Now, during the pandemic, there was all sorts of politicization and so forth, but on the whole, when you poll populations, they say they trust scientists more than almost anybody. And so the fact that the prestige of science with neuroscience and clinical trials are all being used to shape our understanding of these psychedelic drugs in a new way and dissociate them from hippie culture and associate them with medicine, they're starting to have this uptake. And it's not just smoke and mirrors. There are credible reports from these controlled trials at Hopkins and elsewhere of long-lasting, highly clinically significant effects following one or a few therapist-guided sessions. Now, often when you look in medicine, people will use a construct of statistical significance. They'll say, this drug statistically improved this secondary outcome compared to placebo. And then you look at the effect size, and it's very small. That is not what's happening with these drugs. These drugs are blowing statistical significance out of the water. And they're clinically significant in the sense that you really do get better if you're among the subset of people for whom the drugs work. Moreover, psychedelic drugs are not addictive. They're not physiologically habit-forming. In fact, it's a pretty intense experience, and you probably wouldn't want to do it every day. Moreover, it's physically safe, and I've put an asterisk there because safety is an interesting question, how you define that. So, treatment-resistant major depression, anxiety, fear of death in terminal cancer patients, post-traumatic stress disorder in war veterans and first responders. And there's some preliminary evidence suggesting that these drugs may be helpful for smokers who've been trying to quit for decades. There are some reports that under one of these influential drug-assisted psychotherapy sessions, they give up smoking completely. And there's trials going on right now to see if these drugs can help with alcoholism, which is an extraordinary widespread problem. So I'm going to argue for a need for caution here. I think it's pretty easy to get swept up by all of these exciting findings, which are genuinely exciting, and not think through the ethical implications or how we should respond as a society. So some of the early findings had a control group. You have to see how it works in people who have certain psychiatric conditions, but then to test out the safety of the drug, you have a control group of people who are called healthy normals or healthy volunteers, people who don't have a specific diagnosis. And what was striking is that these healthy volunteers who don't have a medical problem relevant to these drugs reported that at the end of the trials, they felt that they'd had one of the most meaningful life experiences that they can remember in their entire existence. They said it was comparable to the birth of their first child in terms of reorganizing their sense of values and what they care about and how they engage with other people. Or it was as significant to them as the death of their parent and how they had to grapple with that. Now, this is a drug being administered in like a clinical environment as part of a medical study. And people are reporting some of the most meaningful life experiences they've ever had. That's not something you normally get with medicine. So already we have to think, how are we going to handle this? Moreover, they would talk about an overall sense of well-being and a better ability to interact with others in a loving and a caring way, to let go of grudges and so forth. People are reporting all sorts of resilient changes that on just a common sense view seem like they're becoming better people in some way. So this goes back to the old treatment enhancement debate I started with cognitive enhancers. Most people are comfortable with administering drugs if we characterize them as medicine and we think that we're treating a medical problem. Many people are uncomfortable with the administration of drugs if there's no medical problem, and the thought is it's just going to be good for the person in some way, because we don't have a paradigm to understand that. But that's what enhancement is. So when I drink coffee, it's not because I have coffee lack disorder. Like I said, I do it just because it helps me concentrate in a way that I find valuable when I have to give a talk and I've been traveling since the early hours of the morning. So maybe these psychedelic drugs don't have to be only characterized as medicine. Maybe we could begin to think of them as well-being enhancers or even moral enhancers. So all these exciting results have led to accelerated legal and regulatory changes. There's decriminalization being proposed in different countries, in different states of the United States, where I grew up. And the state of Oregon is actually implementing something like an enhancement model. They're opening these clinics, I think this year, where psilocybin from magic mushrooms has been legalized. So it's not just decriminalized, it's fully legalized. And the thought is people should be able to come into these quasi-clinic environments and use the drug for personal purposes, for what they think would be a good use, rather than having to go through the whole rigmarole of talking to a psychiatrist who has to give you a diagnosis and then you call the drug medicine. So this is becoming real as of right now. There's also been this upsurge of pharmaceutical interest and business interests. Everybody wants to get a piece of the pie. They want to figure out how are we going to monetize this new psychedelic renaissance. So here's the first potential serious ethical problem, is the problem of hype. I'll just give you an example of this, of how easy it is to go from a carefully described empirical finding in a scientific study to a crazy headline suggesting that a miracle cure has been discovered. So in our book, Love Drugs, Professor Savlescu and I made a recommendation that ideally the use of these powerful drugs should be done with a trained therapist in a guided setting with some controls in place following a well-rehearsed therapeutic program. And we gave all the reasons for that view, but we had a response from a very prominent bioethicist, like one of the world's smartest people, who read our book and saw all of our caveats and drew the conclusion that, listen, if a chemical intervention has been shown safe and effective, and if a competent individual consents to use it under conditions of informed consent, then using it without any accompanying therapy will sometimes not only be permissible, but even morally mandatory. Like, whoa, look how quickly that got out of control. So we wrote back, we said, that's not what we said. We didn't say they're safe and effective in every environment as used in any way. What we said was, both MDMA, which is known as ecstasy in recreational use, and psychedelics, and then here are all the caveats, administered at the right dose by a trained therapist in an enclosed, peaceful setting, in the context of a therapeutic protocol, drug purity having been assured, medical staff on hand to monitor vital signs to be alert to any problems, have been shown to be physiologically, not necessarily psychologically, safe and effective, or efficacious, meaning they have results for trials, but we don't know the results in the real world, at reducing symptoms of some well-defined psychiatric disorders, or for healthy volunteers, increasing certain positive traits and behaviors such as resilience and psychological flexibility, in appropriately pre-screened and adequately prepared individuals over the course of the study period as long as they were taking measurements. And there's some long-term follow-up for some of these results, but in some cases it's shorter. So somehow all of those caveats, which are explicitly and repeatedly put in our book, just got turned into, hey, the drugs are safe and effective, so people should just be able to use them. So I want to make a bigger point. There's this rush of interesting neuroscience and medical changes, and psychiatry is getting involved, and there's clinical trials. Legal changes are now following suit. Regulation changes are following suit. Business is coming in, trying to get a piece of the pie. Big pharma is now interested in figuring out how they can monetize these drugs. But what about the ethics and the regulation and the way of keeping this ship somehow heading into a positive direction? Because if it all goes off the rails, then all these wonderful things are not going to materialize. So a big worry that I have is that this hype bubble is going to burst in the very near future. And there will be backlash from conservative elements in society who say, we told you these drugs were irresponsible, recreational things. And look, we've had some sort of problem because people were using them in a way that was not consistent with the way that they were studied. And then the drugs are going to go back underground for another 50 years until somebody figures out how to get another permission from the government to run a clinical trial. So I want to just, let's see how much time I have. Okay, all right, so I'm going to go through some examples of ethical concerns that we should have when thinking about how we want to bring these drugs into society. Now, the toothpaste is out of the tube. These drugs are going to be in society through a medical door or through other doors. So what are some ethical concerns we should think about? I may only be able to get through the individual level, and then we'll talk about relational and societal levels at the Q&A, but we'll see. Wish me luck. Okay. At the individual level, a major premise of bioethical reasoning is that informed consent is the bedrock of ethical treatment. And my concern is that this hype bubble could undermine informed consent. And let me illustrate that. Here's a popular article I saw recently. I tried ketamine to treat my depression. It was terrifying. So what's this person's story? My ears perked up in recent months when I began to hear the buzz about ketamine, the anesthetic and hallucinogenic drug that has found a new market as an antidepressant. Numerous credible studies have documented benefits, including that it's fast-acting, with patients sometimes showing improvement within a couple of days. And social and other media have featured doctors and patients describing it as life-changing, as it has indeed been for many patients, with one user commenting that I felt like a completely new person. So, with a referral from my therapist, soon enough I found myself on a psychiatrist's couch, a doctor specifically trained to administer the drug. So this is actually the best case scenario. This is what we recommend in our book. After determining that I was medically healthy, so pre-screened, as we recommend, I was an eligible candidate, the psychiatrist, who trained at Yale, where much of these studies have been conducted, so like the world's expert, briefed me in detail on all the possible side effects, short-term spikes in blood pressure, headache, nausea, and vomiting. The 9-page consent form also included this sentence. At the dosage level administered to you, you are likely to experience a mild anesthetic, anti-anxiety, antidepressant, and potentially psychedelic effects. Like what? Well, like a loss of sense of self, changes in the perception of time, dreamlike visions, and feelings of connection, joy, and peace. Now, some of those things sound great. Connection, joy, and peace sounds like what we should be aspiring to. But what the author says is, in looking back, I realized I did not fully appreciate what all of that really meant until I went through the experience, and it was a terrifying experience. So I won't go through the terrifying experience, but this is just the setup. So did he give informed consent? Well, these bioethicists have proposed that there's actually a deeper problem here because psychedelics are characterized by many who use them as inducing a transformative experience. And that's a technical term in philosophy, which I'll introduce in a second, but it means that there's certain kinds of things you can't reason about rationally because you don't know what you need to know to do so. And the only way you can know it is by experiencing it. And so if you're facing a transformative experience, like getting bitten by a vampire or something, you can't reason about what it's like to be a vampire until you're a vampire, because it's totally different from what it's like to be a human. And so this has some implications for informed consent. These authors say, when beneficial, the psychedelic experience is characterized by features unlike those of any other psychiatric and medical treatments. These include senses of losing self-importance, which could be a good or a bad thing, ineffable knowledge, feelings of unity and connection with others, and encountering deep reality or God. In addition to symptom relief, psychedelic experiences often lead to significant changes in a patient's personality and worldview. So here's the notion of transformative experience that philosophers talk about. This is a notion that's been popularized by Lori Paul, who's at Yale now. And it's interesting that she titled her paper on this topic, What We Can't Expect When You're Expecting, which means when you're expecting to give birth. Because giving birth to your first child is a transformative experience. You have no concept of what it will be like to value things completely differently from how you do now until you're looking at your first child. And so that raises an interesting question, which is, can you give consent, informed consent, to sexual activity, given that it may lead to a transformative experience which you can't rationally engage with? You can't be informed in the way you need to be under classic interpretations of informed consent. So you could take this different ways. One view might be to say, well, there's a lot more to determining whether something's ethical than whether it happened under conditions of informed consent. Maybe we can give morally valid agreement to undergo a transformative experience, even if we aren't informed. So that's one possible argument that you could make. So, one potential difference between giving birth and taking a psychedelic drug that you've never really used before is that the birth-giving process is couched in rituals and narratives and stories and community and TV shows that you've seen, and you have a sense of how it is. And, whatever is your culture, you might have a midwife helping you give birth at home, or if you're in a kind of Western hospital, you'll have a doctor wearing a white lab coat. I mean, these are all rituals. You don't need to wear a white lab coat necessarily, but it's just part of the thing that we use to structure our experience and to feel that we know a little bit more about it than maybe we do. And if you have those supports in place, then maybe you're going to have a better experience as opposed to a terrifying experience. So, this, of course, is how psychedelics have been used in indigenous communities for a long time, in the context of known rituals and passed down traditions and certain structures of who's the leader and who has knowledge and so forth. So that's radically different from a teenager experimenting in their basement. And it's likely then that you're going to have radically different types of outcomes if you have a structured experience, as we argue for in the book, versus what the other bioethicists argued for. Consenting adults should be able to take whatever drugs they want. So technically, that's as much as I have time to say in 45 minutes. I could go on for another 5 minutes and take questions. What do you think? Should I do so? Okay, all right. So informed consent is often characterized as a kind of individual level thing. I go to the doctor, I have some symptoms, they offer me a drug, and then the question is, did I give informed consent to the drug? Now, the book that I've been alluding to is called Love Drugs, and the point is these drugs might be helpful for relationships, not just for individuals. And so we'll have to think about ethics gets complicated when you put two people in the room, because now it's not just one person's informed knowledge. There's dynamics to pay attention to. So this makes the ethical conversation all the more complicated. So there's many types of relationships, but we focus on romantic relationships in our book. So this is a relationship that's based fundamentally around care, the dispassionate concern for the well-being of the other party. So this is Professor Savulescu. This is our book. In the US, it has a slightly different title. It's called Love Drugs rather than Love is the Drug, but it's the same content. And so these ideas I'm about to share with you come from there, and I want to give credit to my co-author. So in August of 2017, the FDA, the federal gatekeeper in the United States, designated MDMA, ecstasy, as a breakthrough therapy for post-traumatic stress disorder, which is one of the hardest things to treat and also one of the most devastating conditions a person can have. But this therapy is all individual-centered. You, with the PTSD, go there and you have an experience and you hope that you relieve your symptoms. But we argue that we should be thinking about the fact that each of us is embedded within a system of social relationships, None of us is an island. And so if we aren't, as scientists, paying attention to what are the implications of powerful drug use for relationships, if we're not even measuring the interpersonal effects of these drugs, it doesn't mean they're not happening, it just means we're doing it in the dark. And so we argue that at the very least, if we're going to bring these drugs back into society, which are very powerful and have the potential for extraordinary good and also extraordinary awfulness, then we should be measuring the outcomes not just for the individual, but for relationships, for societies. So take the example of PTSD. PTSD can be devastating to relationships. Somebody that you thought you once knew who comes back from the war and is suddenly unrecognizable and treats you aggressively. That's not just an individual problem. Marriages regularly break up over PTSD. So if you have an effective cure for PTSD, as some of these early trials suggest that psilocybin can be if used in the right way, well, that's going to be good for the relationship too, ideally. But this is still stuck on that old treatment model, the idea that you have to have a medically diagnosable problem in order to deserve to have access to a drug. But mental illness and trauma exist on a spectrum where, for various historical and often arbitrary reasons, psychiatrists draw a line and they say, okay, if you score a 6, then you count as having the problem, and if you score a 5, you don't have the problem. But what's the difference in reality between the 5 and the 6, experientially? So, it might be that people who don't meet formal diagnostic criteria might nevertheless truly benefit from the use of these drugs in an appropriately conducted couples setting, not just individual setting. So maybe ordinary relational difficulties could one day be seen as an appropriate place to intervene for couples counseling supported by a drug. And so, this is not a new idea either. In the 1980s, MDMA was used primarily in a therapeutic setting by psychiatrists, including for couples counseling, before it kind of escaped from the lab and got used in the party scene. And then it triggered this backlash. So these psychiatrists give a narrative account of their experience with 80 clients from the early 80s before MDMA was made illegal. They argue that this drug, administered in the right way and with careful oversight of a trained professional, can help individuals achieve a more healthy and accurate perspective of who and what they are psychologically, by decreasing irrational fear responses to perceived emotional threats. The way that MDMA works is it temporarily reduces a kind of hair-trigger fear response that you might have to stimuli. And in PTSD, this is what's happening. You hear a sound outside, and instead of responding to it rationally and reasonably, you have this overwhelming response that maybe it's a gunshot or something like that. You're not calibrated to stimuli appropriately anymore. And of course, in a romantic relationship, that can happen too. Your spouse makes some stupid little comment about washing the dishes, and you flip out because you have a problem in the relationship. And so, figuring out how to dampen down that kind of hair-trigger fear response when it's not adaptive, when it's not helpful, you could do years of talk therapy to try to work that out, but if you suppress that tendency directly in the context of talk therapy, people find that they can have much more fruitful conversations with their partners. Neurochemically, what happens is it causes the release of serotonin and other neurotransmitters and keeps them at play between synapses. Subjectively, it imbues users with a deep sense of love and acceptance of themselves and others, which are the perfect conditions for trauma therapy. Now, we might want to ask, if you're suddenly imbued with a deep feeling of love and acceptance because you're on a drug, is that real? Is that an authentic experience of love? How do you tell the difference subjectively between whether you're having a real experience of love that's phenomenologically indistinguishable from a drug-induced feeling of love? So there are some deep questions here, and we'll talk about those in the Q&A. But couples reported feeling more loving toward their partners. They could forgive the pain of the past. They could let go of grudges and misunderstandings and so forth. So they say the same point all these others have been saying. We never recommended MDMA as a cure. We said that the couple had to cure themselves with the assistance of the drug in a therapeutic context. So I'll conclude with this, which is that, again, we have to think of these drugs, if we're going to use them, as facilitators to a therapeutic process, not as something that's just unleashed onto the population or poured into the drinking water. The effects of a drug wear off, and depending on the drug and the dose, it might be 4 or 5 hours that you're under the influence of this drug. And then, the drug doesn't magically cause you to feel love for your partner or somehow magically make you a better person. It's that the actual lessons that you learn in the therapeutic setting, when you're in a mindset to be more receptive to those lessons, and then the drug wears off, and you have to integrate those lessons into your normal waking consciousness that I assume most of you are experiencing right now. If you don't do this process of integration, then it's not clear that these experiences will be helpful. So, just so we have time for conversation, I'll let us think together about what are the societal implications now that I've raised some concerns at the individual level and the relational level, and I thank you for your time and attention.